for me coming here, this is the kind of, I would say, holistic care that I needed.
I'm much more relaxed. I have less anxiety.
Just a great feeling. Never really experienced anything like this before.
We have to listen to our own bodies and get in touch with that, and this work helps me with that every day.
For me, it's been really wonderful. A real turnaround in my health and my outlook on life, too.
But I really feel like I am getting my health back.
In the heart of the Green Mountains of Vermont, a small family health care practice has been changing the lives of thousands of people, young and old alike. The Rushford Family Chiropractic Center has been the leader in innovative holistic health care for northern Vermont since 1994. State and nationally board-certified chiropractors Drs. Matt and Julieta Rushford are members of the International Chiropractic Pediatric Association and hold advanced certification in the groundbreaking technique of network spinal analysis. Join Drs. Rushford as they lead you on a journey into the heart of healing.
Hello, I'm Dr. Matt Rushford, founder and co-director of Rushford Family Chiropractic. This DVD is intended for anyone who's interested in learning more about network chiropractic, including doctors, nurses, physical therapists, and other healthcare practitioners. But it's especially for those individuals out there who may be helped by this work. What brings people to Rushford Family Chiropractic? We see people with everything from back problems like chronic low back pain and neck pain and headaches, to people struggling with stress, depression, children with attention or hyperactivity issues. Some of our patients are coping with deeper organic disturbances like diabetes, high blood pressure, cancer, and heart disease. And yet our work is not a treatment for any of these. Network spinal care, also known as network spinal analysis or network chiropractic, is about elevating the overall functioning of your body by correcting disturbances in the spine and central nervous system. Being under regular chiropractic care helps all your body systems operate on a higher level. The remarkable results our patients experience with these specific problems and their overall quality of life are really just a positive side effect of a healthier spine and nervous system.
Chiropractors adjust vertebral subluxations. Subluxations are interferences along the spine that obstruct the proper flow of mental impulses from the brain to the body, and that causes poor health.
Correcting subluxations liberates the body's natural, healthy capacities from above down and inside out. It is the body's own miraculous healing potential that is responsible for the powerful changes our patients enjoy. What makes our technique, network spinal analysis, different from regular chiropractic? First is the amount of force needed to make an adjustment. Our adjustments utilize gentle, specific contacts, which catalyze a response in the patient. It is that spontaneous response which creates the adjustment. These gentle contacts on specific areas of the spine elicit spontaneous changes in breath and movement which actually correct vertebral subluxations from the inside out. Let's take a look.
Okay, so the first thing you'll notice is that we have her whole spine is moving. Can everybody see that when she breathes? Everything is moving from here to here, not just in here. The second thing that's starting to happen is that we're starting to get a kind of a little bit of this type of motion. And you can see how much this part of her spine is moving while she's breathing. All of this movement is just spontaneous. She's not trying to do it. It's just happening as a natural response of these very specific contacts, which are geared to address the areas of stress and tension that her spine was showing up with today, right now. So again, the first thing you're seeing is breath starting to expand through the whole spine. You can see even this part of her spine lifting up and down, as if she has lungs in her neck. she does it. But this is the normal way of breathing, that your whole spine moves as you breathe. And now this part of her spine is what's called initiating a standing wave. It's a wave generating machine right now. And it's creating this motion that's going to roll through her whole spine. Have you ever been to Sharper Image and gotten on one of those chairs and they had the thing, what does it do? It rolls through your spine, rolls up and down. Well, those things will probably really mess up your spine. I feel sick as hell after I use them. And the reason is that it's not really a movement that's generated from the inside. It's introducing motion to an area that may not be ready to move and release. I'm not making this happen. Her own body and nervous system is generating these motions based on a renewed connection between now and then, and its own response to the new information that's coming in. Keep that down for a second. There you go. Keep a little pressure and breathe. Just try to breathe in this area mostly, okay? Hold on. Okay, again. Is that okay for you? Okay. Let's keep the pressure and keep breathing. So I'm giving her a little bit of coaching right now just to help keep her body from getting too comfy. Lift me a little bit. There you go. Keep the forehead down and lift. There you go. Hold that as long as you want and release it when you're ready. So part of the coach relationship here, coach-patient relationship, is that I need to challenge her when she gets to a plateau and challenge her nervous system to find new ways to circumvent stress and tension and protective patterns. And look how amazing this motion is through here. Just a lot of ease. And see, and now what we're starting to get is we're starting to get this kind of motion. Right? So it's moving this way as well as this way. Not just like this, but like this. You all see, can everybody see that? Right? So we have lateral flexion range, flexion extension range, and rotation. So all three XYZ axes are being accessed right now. Everybody see that? And this is really the current apex of the respiratory wave that we want to engage, is all three axes of range of motion being accessed by the patient spontaneously, so that no matter where that subluxation is, her nervous system will find it and have the access and movement to be able to correct it with breath. So really what the adjustment does is it creates the opportunity for your body to let go of something, but it gets to choose whether it's ready to let go of it. Most of the time, it will. Given the opportunity, our body will choose ease over stress. Just this phenomenon, this breathing wave-like motion, is strongly associated with improvements in quality of life on a spiritual level, quality of life on an emotional level, on a social level, adaptations to stress, physical health, sexual health, gastrointestinal, genitourinary health, mental focus, depression, and a whole slew of other types of responses. And you might wonder, what does a 2.5-year-old need to get an adjustment by a chiropractor for? But you also might recognize that life for a 2.5-year-old can be pretty stressful. Even when we're 2, we can go through life experiences that are very challenging. And imagine going through those experiences, and when your body starts to hold on to tension and things start getting choked off, you have the opportunity to reset, release, and find a place from the inside out of ease and peace and joy.
I can tap into my spiritual sense and my emotional side, and there's many times where you break down here, and I never broke down my other chiropractor because the setting wasn't correct for it.
Well, last year I had a pretty major medical issue happen, and the Rushfords were able to really help with clearing a lot of stuff that was going on, especially around being depressed.
been a great experience. I've dealt with other offices, different phases of chiropractic, and found this to be the most helpful. It's a great feeling to be able to put your socks on without being in pain, and able to make it through the day with my jobs that I do, where I was having some problems getting through the day.
That because of the adjustments, my back feels more like I was 35 than 60 something, and that has been a direct result of the adjustments and coming here. I found a real improvement in my quality of health.
I had issues where I couldn't do my work. I couldn't physically go to work and perform. And each time I got adjusted, it resolved.
And one of the first benefits was for Julieta to say, the problem is not in your back, it's in your neck. And from about the fourth adjustment, pain that I had been enduring pretty constantly from waist down for about 6 months was easing. And by the fourth time, it was gone.
It helps my breathing, and it gives you a really nice feeling of peace, and that's what I find different from network than traditional. Traditional, I felt really good, but I didn't have that extra added part, that a different feeling when you leave.
And one of the unexpected benefits, and it took I had a moment this spring, was I went, I'm not having any allergic reactions.
On a very personal note, it's the one place, and I'll probably get emotional, but that I feel like people really care about my health, and I spend my time taking care of everybody else. So this is really a wonderful place for me. I have made it a priority.